My name is Michaela and I'm from Dallas, Texas. I'm a mother of 3 children, a wife, a nurse, and an ovarian cancer survivor. I had some lower back pain, bloating, exhaustion. However, I attributed it to having 3 boys, all under the age of 10 at that time, and decided that I should probably go get checked. Found out that I had a 10-centimeter tumor on my right ovary. Decided to have surgery, obviously. Woke up, found out that it was actually ovarian cancer, and the road started from there, and that was in August of 2009. From there, I went to MD Anderson, went through genetic testing, found out that I was an increased risk of breast cancer within 3 years, because I have a biological sister who was diagnosed at 36 with breast cancer, as well as a paternal grandmother and paternal great aunts. At that time, that's when I elected to decide to have a double prophylactic mastectomy, and decided to have one in December of '09, and then from there had reconstruction in April, late May of 2010. I was 32 years old and really wanted to have the reconstruction because I felt that it was an identity for myself as a woman and as a mother, and that's one of the things why I chose it. It was very important to me at the time. You identify yourself as a woman because you have feminine parts, and when those are taken away from you, it's a piece of you that is not the same anymore. And feeling that you can wear a swimsuit again if you want to, a bikini, or if you want to wear a strapless dress, those were very important to me at that time. And I knew that was something that I needed to do, and it was something for myself. It was not for other people. It was for myself that I knew that I needed to do. And a lot of women choose not to do that, but that's their choice, and that's for them. That's great. But for me, it was not an option. I wanted to have reconstruction. Picking a physician that has done this many times, that focuses on these type of surgeries is crucial, because if they have that experience, they know what the questions are, they anticipate the questions from the family members, but they also feel comfortable talking to the husbands or talking to the partners of the patient, and they can educate them on what to expect. Because even though I am a nurse, I was not expecting that after I had a prophylactic mastectomy that it was going to be difficult for me to even lift up a glass and drink water afterwards. And that was crucial. I didn't know. I figured, well, yeah, I'm not going to be able to use my arms and my hands very much, the first several weeks. But immediately I couldn't even take a glass to drink water, and I couldn't take a shower on my own, and I couldn't wash my hair, and I had to have somebody help me with that. And so having family is very, very important, and having a physician that will educate you and assist you and prepare you effectively and adequately is absolutely important. The women in our family had different views on whether or not I should have a prophylactic mastectomy, which was very interesting to me because my sister had breast cancer and also had a double mastectomy. But for me, because I did not have breast cancer, it was a choice with even my mother-in-law that was like, really, do you really need to do this? And my mom was like, are you sure you really want to do this? And I'm like, yes, I do. But when I would talk to my friends or my close, family members that I was very close to, they were like, yeah, go ahead. This is totally you. This is your body. You need to do what you need to do. And, my husband, of course, was a huge component in that as well. And discussing it with him, we decided that it was the best choice. And it wasn't just it was myself. I felt that this was the best choice for me. But if I did not have the support of my family, it probably would have been very difficult. Not only in just the decision-making process, but the recovery process, because I needed so much help. Not having that option, that's hard. I think that would be hard for anyone, especially a woman. Choice is a big thing for women. If I had the choice and I wanted to have the prophylactic mastectomy but did not have the resources to do that, that would be very difficult, because that's what I wanted. And I think everybody should have health care. I believe that everybody should be able to have that option. If they want to have reconstructive surgery, they should get it. And there should be people out there who can help with resources for that. I don't think anybody should be denied for that. And I think it would be very difficult to have that. I think the information that I would give to a patient who is looking for a physician or a surgeon to help them with their prophylactic mastectomy or just their mastectomy in general is to really find out how often do they do this surgery. Are they doing it consistently? Is it only once a year, or is it 4 or 5 times a day? There is a big difference. Do they specialize in it? Are they board certified in it? And that's one of the things that I think needs to be out there, is that they need to find a board certified physician who has been doing this, who has plastic surgery experience, who's been a breast oncologist, a breast surgeon. It's extremely important. I also feel that giving the advice of learning who the physician is, and do you have a rapport with them? Do you feel comfortable asking them questions? If you don't feel comfortable with them and you feel kind of odd when you're interviewing the physician, then that's not the right doctor for you. Because if you don't feel comfortable asking the physician questions before he does surgery on you, you are not going to have the comfort in asking him questions when you really have the questions, when you're hurting and you're in pain, and is this right? Is this what we're supposed to be feeling? That would be my 2 biggest things that I would definitely recommend to any patient who's looking for that. My future is the same as it probably was, before I was diagnosed with cancer and before I even had my reconstructive surgery. I'm still going to be a mom. I'm still going to be a sister. I'm going to be a wife. Moving forward, I'm in my nurse practitioner school now. I'm going to get my doctorate, within the next 2 years. I'm going to live my life the same way as I was before. The only difference is that I can go to bed every single night and know that I reduced my chances of getting breast cancer within 3 years, and that I can still be able to feel like a woman, act like a woman, and I'm still my old self, just that I just have reconstructive breasts, So, same person.